For the first time in history, we are entering a period of time where we have more jobs than people. That will fundamentally, and already is, fundamentally shifting how we think about recruitment and retention and engagement.
We know that our patients come to us expecting that we're going to give them good clinical care. That's the baseline. In order to bring an N of 1 experience to our patients, we as an organization have to bring an N of 1 experience to our colleagues.
We believe as a leadership team and as a healthcare community that if our teammates are engaged at the highest level, they then provide our patients with the highest level of care, assistance, and facilitation. So if I look at the term employee, for me that is really a Department of Labor term. We want teammates. We want everyone to be involved in understanding that their contribution is important to the overall patient experience.
The trust and the compact that happens between each caregiver and the patient is fragile. And we have to treat it with the utmost care. And the way our colleagues will be able to treat that with the utmost care is when the organization, in their compact with the colleague, treats that with the utmost care.
We have a definition of engagement that is, discretionary effort. It is giving of not just my excess, but my substance. The nurse or the physician or the lab tech didn't just show up and do his or her job, but they kind of went over into that other territory of digging deeper and shared a little bit of who they were.
If I have a caregiver who walks into my room and is exhausted, doesn't feel they're in a safe working environment, the patient's going to pick up and feel that. The patient isn't going to feel safe. We're going to increase suffering rather than reduce suffering, both for the colleague and for the patient.
So if we are able to create a work environment where our colleagues are nurtured body, mind, and spirit, they have that to give to our patients.
We made the decision to use Press Ganey as our partner strategically so we could hear the voice of the colleague and the voice of the patient, and then see how we create an atmosphere where both of those voices can sing in their best tune, if you will.
I take the survey extremely seriously because it's giving me that pulse of the organization, places and teammates that I would not be able to interact with. They have a voice in the survey.
When you are 120,000 strong in 22 states, it is the best and the only way we have to hear the voice of that many people from that many locations.
What I like is taking the questions and looking at them from a scientific perspective of turning anecdotes into really objective data for decision making. And so the survey is a very important tool in my human resource strategic planning.
Every person is sacred, and every person deserves to be treated with dignity. This work is helping us say we don't have to make a choice. We don't have to choose who comes first in the equation.
When we recognize and uplift and engage our teammates, we are confident that that translates into an extraordinary experience for our patients.